somebody, when they leave hospital, obviously they'll have their bag brought in. What else will they need to take with them, or what will need to be with them when they're at home?
So I think that's a really important question, and I think anybody who has this surgery will hopefully talk to somebody who's also had this surgery previously, and as part of that discussion, I'm sure they will disclose everybody has a bag or a kit or a purse or a wallet or a fishing box or something that they keep their essential kit in, and they've got a home kit and they've got a kind of on-the-go kit, most people. And in the home kit, or at home, you need to make sure that you've got a really good mirror with a light that you can see your stoma and your voice prosthesis if you have one. You need to have a dilator that you can use in emergencies if you need one, or a catheter. You need to have things to clean the stoma, so you might have tweezers or cotton bud applicators. But I would say at this point, it's really important to realise that this surgery leaves obviously an open entrance down to the windpipe. So making sure that you only use equipment that's licensed for use around the open stoma, that you use really safely the brushes that are provided, for example, that have the little T bar on them so that they can't be dropped down the stoma. So you'll need a torch or a flashlight. You might need particular swabs that you might like to clean with, wipes that might be provided, and again just making sure that you use exactly the wipes that are designed for use around the stoma, because you don't want to be breathing in anything that's very harsh. What else have you got, Alan, in your kit? What have I missed?
Oh, interestingly, I did have a fishing box. I did, and I still got my fishing box. I must say, I still have my fishing box. I haven't used it for a while because after 9 years, you literally have got a handful of things I need. You know, once you settle down, you know exactly what you need, don't you? You know, a couple of brushes, the tweezers, you know, some really nice hygienic wipes to clean the area. You know, then I'm done really. But that's me. I'm 9 years, so I mean, I'm thinking that's really really good information. But I know that some patients, when they go home, they may have a suction machine or they may have a nebulizer. Is that common that people take all these home with them? So I mean, will there be a big truck delivering things? Or?
That's a really good question, Alan, because obviously one of the big considerations after surgery is keeping this area very well humidified. So making sure that people understand that breathing in direct room air probably isn't the best. So really trying to make sure for really good lung health that the stoma is covered with one of these HMEs, as we call them, heat moisture exchangers, as you've got. And you can use a nebulizer, and certainly in the early days post-surgery, people will be using nebulizers. Now, interestingly, I think it varies from centre to centre. It probably varies from country to country. So not all of our patients go home with a nebulizer, and not everybody goes home with a suction machine. But I think some centres, they do. So I think it just depends on the centre and probably individual needs as well. But I think really remembering that when you go home, you have to have the knowledge and the safety so that you make sure, for example, you don't develop a mucus plug within the trachea, so that everything is so well humidified that that's quite unlikely to happen, and that you know what you would do if that did happen.
Yeah, brilliant. Thank you.